Welcome to the Alabama Public Health Training Network. Thank you for joining us for this program, Public Health Response to Infectious Disease. If you have questions about anything being discussed today, please call or email during our broadcast. The phone number and the email address are on your screen now, and they will appear later in the program. Also, the handouts, sign-in sheet, and evaluations are all available online. You will need to register for this program in order to access those materials. Continuing education credits have been approved for nurses and social workers for today's program. In order to receive credit for this training, you must watch the entire program and then complete and return the sign-in sheet and evaluation. While content may continue to be relevant, continuing education credit will only be awarded for 1 year for nurses, expiring on July 31st, 2018, and 2 years for social workers, expiring July 31st, 2019. Now, let's meet our presenters. We have Phyllis Martis with Community Environmental Protection, Ron Dawsey with Environmental Services Division, Latasha Foster, epidemiologist with the Immunization Division, and Marilyn Knight, a nurse educator. Thank you all for being here. Now let's get started with Phyllis, who will be covering vector-borne diseases.
Good afternoon. I will speak to you on vector-borne diseases. I borrowed this slide from the CDC. It talks about arthropods, birds, and mammals of public health significance. We begin with what is a vector. First, let's determine what a vector is. By definition, a vector is an agent, person, animal, or microorganism that carries and transmits an infectious pathogen, which is a disease-causing agent, into another living organism. Vermin or pest is actually a very broad term that basically defines organisms that are an annoyance to humans because they are in places we don't want them to be, like our homes. In most cases, the vermin and vectors are also pests. Pests consist of any of various small animals or insects that are destructive, annoying, or injurious to health, including, but not limited to, flies, cockroaches, rats, foxes, weasels. Environmentalists are involved with these two definitions, which are found in our solid waste rules, because vector complaints are often the result of mismanagement of solid waste, so the two programs dovetail. In Alabama, the federal vector program began in 1964 and was later transferred to the state health department. Since that time, there have been varying degrees of support for and in the counties. Programs have ranged from having no one at the county or state level to occasionally having a veterinarian or an environmentalist on staff. Currently, we have a central office contact and 3 county health departments with full-fledged vector control programs. Those are Baldwin, Madison, and Mobile counties. Even though we have those programs, all environmentalists are involved in vector control at some level because of food sanitation and the mismanagement of solid waste. Vectors and pests we have a number of disease vectors of public health concern, but for the purposes of this presentation, we were limited today to those listed here: the bats, birds, cockroaches, flies, kissing bugs, mosquitoes, rodents, ticks, and bed bugs. We are most concerned with vectors because solid waste attracts or is a breeding ground for flies, rats, and mosquitoes, and these are going to comprise most of the complaints that environmentalists received. We also received quite a number of mosquito complaints that are related to stagnant water situations, especially with the recent outbreak of the Zika virus. Close behind on the complaint list are bats and bird roost, lice, and occasionally a tick complaint, which is usually associated with a dog complaint. Environmentalists may also receive phone calls on bed bugs, biting flies, honeybees, venomous insects and spiders, and chiggers and red bugs. As far as bats can transmit, among other things, rabies, salmonellosis, and histoplasmosis. The rabies can be transmitted actually by the bats. The incubation period is usually 4 to 12 weeks for a person to develop rabies symptoms once they've been infected through a bite or scratch. However, the incubation period can actually range from a few days to 6 years. The initial onset of rabies begins with flu-like symptoms, and as the virus continues to attack the central nervous system, there are two different types of rabies that can develop. Furious rabies, where the individual affected will be hyperactive and excitable and may display erratic behavior. They may also have problems swallowing and a fear of water. Then there's paralytic rabies. Now, this form of rabies takes longer to set in, but the effects are just as severe. Infected people slowly become paralyzed, will eventually slip into a coma and die. Now, according to the World Health Organization, 30% of rabies cases are paralytic. Both bats and birds can transmit salmonella, which lives in the intestinal tract of animals, including the birds. The salmonella is usually transmitted to humans, however, by eating foods contaminated with the animal feces. And of course, we've also all heard of histoplasmosis. It's an infection caused by breathing in spores of a fungus, often found in bird and bat droppings. Histoplasmosis is most commonly transmitted when these spores become airborne. Most people with histoplasmosis never develop symptoms and aren't aware that they're infected, but for some people, primarily infants and those with compromised immune systems, histoplasmosis can be serious. The inhaled spores affect the lungs and can result in the flu-like symptoms as mentioned before. In some people, histoplasmosis can also produce joint pain and a rash. Now, if you have birds or bat roost, the way to get rid of them if you find them in your house, primarily bats, if you discover a single bat in your home, you can use a small box or bucket to catch it. Once the bat lands and is stationary, use a bucket or box or some similar container to trap the bat. Find something large enough to cover the bat so you won't injure them or crush their wings, because there are 9 species of bats in America that are considered endangered or threatened, so you don't want to damage or hurt the bat. So approach it slowly, cover it, slide a piece of cardboard underneath, take it outside, and release it. In case of an infestation, you can use the one-way cones. The bats will fly out but cannot find their way back in, or they can't climb up the smooth surface. You can also use netting that will allow the bats to push out but not allow them re-entry. Once excluded, build the bats out, which means to seal up the entry points. For birds in buildings, exclude their entry by using heavy door curtains, the plastic strips, or apply sloped surfaces to prevent them from roosting on ledges inside of, for instance, a warehouse. Now, you may have been told that harassment, loud noises such as cannons and squeals and whistles, or even owl decoys will scare birds away. Well, these are myths. They only cause relocation to another spot, or the birds simply get used to them. Then we move to our friend the cockroaches, which can cause diarrhea, dysentery, salmonellosis, or cholera. Actually, there are 69 different cockroach species found in the United States. The cockroach produces allergens, which can come from their feces, shed skins, and body parts, such as their legs and antennae. Susceptible individuals, when they come in contact with the allergens, that can result in mild to severe rashes, other allergic reactions, all to death from asthma attack, but that only occurs in extreme cases. Cockroaches have been found to be mechanical carriers of many diseases, and only the few of them are listed here. They spread nearly 33 kinds of bacteria, including Staphylococcus, E. coli, Salmonella, food poisoning, and Streptococcus, 6 kinds of parasitic worms, and at least 7 other kinds of human pathogens. Roaches pick up germs on the spines of their legs and bodies as they crawl through decaying matter or sewage, and they carry these into the food or onto food surfaces. Pathogenic bacteria have also been identified in the feces of the cockroach. For cockroach management, I borrowed something from a local TV anchor: clean up. Some of the habits that cockroaches have are common to other insects. They need food and water to survive. So find and fix any leaks to cut off their water supply. As I said, clean up, which means to wipe up spills and crumbs, and don't leave food or dirty dishes overnight, and take the trash out regularly. Keep food containers sealed. You can use roach baits, and this will help because of the habits of the roaches. They groom themselves and each other. So if they pick up a pesticide on their legs, they're likely to ingest it during their grooming process. They aggregate, meaning they just nest together, and they simply just like to pile up next to each other. So again, if you put out a pesticide that sticks to their bodies, they will transmit it to other cockroaches when they do aggregate. They also exhibit trail following, much like ants, and they like high humidity. So you look for things behind refrigerators, and if you find a trail, that's where you put the pesticide. You don't have to treat the entire floor, just treat the trail, and they'll pick it up as they go. Pesky flies. Flies transmit diseases in many different ways. They can transmit diseases mechanically, just like we said with the roaches, by landing or feeding on feces or decaying matter, and then landing on your food, and that will be eaten by humans. An individual housefly can carry over 1 million bacteria on its body. Now, flies also ingest bacteria and viruses and then pass these onto foodstuff when they vomit or deposit feces onto food or food contact surfaces. Now, some diseases associated with feces, of course, with flies, are typhoid, which is spread by eating or drinking food or water contaminated with the feces actually of an infected person, but also from the flies dipping in that water and then landing on your food. And parathyroid fever, which is very similar to the thyroid. There's also giardiasis, which is generally an African disease that's spread by the tsetse fly. However, with international travel, we're picking up things that we used to not have here in America. And the most common way to get the giardiasis is to drink water that contains the giardia. As of May 2017, ADPH has investigated over 200 cases of giardiasis. For fly control, of course, there's screening and caulking and the basic things we've been taught. Also, the basic things like we said with cockroaches, which is the cleanliness. Clean up. Wipe up spills and crumbs. Don't leave food overnight. Don't leave dirty dishes, and take the trash out. And also, keep food containers sealed. We don't have that much of a problem, I don't think, with kissing bugs because we don't actually keep up with Chagas disease. However, this bug bites while you're sleeping and usually around the lips, which is why we call it the kissing bug. And it defecates in or near the broken skin, and then as they feed, allowing the transfer of the parasite, which is the triatomine bug, into the host bloodstream. The parasite then causes Chagas disease. Now, initially, it may present like some of the other diseases as a flu-like symptoms, which subside in a few months, and later it can reappear as a heart disease. The CDC has identified Chagas as one of the 5 neglected parasitic infections that require public health action and estimates that there are 300,000 cases in the U.S. Kissing bugs have been reported in 28 United States states, including Alabama. To prevent kissing bugs or keep them out of your house, seal cracks and gaps around windows, walls, roofs, and doors. Remove wood, brush, and rock piles near your home, using screens on doors and windows and repairing any holes or tears. If possible, making sure yard lights are not too close to the house because the lights can actually attract the bugs. Sealing holes and cracks leading to the attic, crawl spaces along the house, and to the outside, having your pets sleep indoors, especially at night, keeping your house and any outdoor pet resting area clean, in addition to periodically checking both areas for the presence of the bugs. Now, especially because of last year, we've been inundated with many calls about mosquitoes, and actually mosquitoes are considered the most dangerous animal on earth. Because they have direct contact with the host blood supply, they're very effective transmitters of disease. Among the diseases the mosquito transmit are malaria. 500 million people are infected every year. And in Alabama to date, we've had 1 case in 2017. There's also yellow fever. There was a Memphis outbreak in 1921, because that's a long time ago, but it's still here. And it's also common in Mobile and New Orleans. As a matter of fact, they said without mosquito control, these areas would be uninhabitable by humans. Then there's dengue. There's a Texas outbreak of dengue in 2013 and 53 laboratory positive cases. For 2017, Alabama has had 1 positive case. With chikungunya, which is also spread by mosquitoes, we've had 1 positive case in 2017. And as of today, if I'm not mistaken, we've had 3 positive Zikas in 2017. To avoid mosquito bites, use the 3 T's and the 3 D's. The 3 T's are to tip, toss, and treat. So tip or turn over containers holding water. Store large items in a manner that will not allow water to accumulate. Toss. Keep the area free of litter and debris. Something as small as a discarded bottle top can breed mosquitoes. And treat. Treat outdoor areas with pesticides to control the adult mosquito population. And with the 3 Ds, drain, dress, and defend. Drain, which is to remove breeding environments by draining water from your property. Dress, if you're going to be outside, even though it's very hot or warm in Alabama, it's still suggested that you wear light-colored, loose-fitting, tightly woven, long-sleeve shirt and long pants, socks, and shoes. We suggest light-colored because light-colored clothing is less attractive to mosquitoes, and wearing tightly woven clothing will make it more difficult for the mosquito to bite. And then defend. Use an Environmental Protection Agency registered insecticide repellent, one that contains DEET, picaridin, IR 3535, or oil of lemon eucalyptus are the ones that we generally recommend, but you can also check the EPA website for a list of registered repellents. Another commensal thing that we deal with are rats and mice. They cause more human deaths than any other mammal on Earth, and they've caused over 10 million deaths in the past 100 years. They do have a commensal relationship with humans, meaning that they live at humans' expense without contributing to the relationship. Diseases can be transmitted to humans in several ways, through the rat bite, for instance with the rat bite fever, and rodents can also carry fleas and other parasites that cause diseases in humans. And then there's property loss. 25% of all fires in the world are caused by rodents gnawing on wires. And of course, we all know about food contamination. 25% of the world's food supply is contaminated every year by rodent droppings in urine. Rodents urinate in feces, and that can spread disease. For an example, there could be a problem with a rat infestation in a grocery store. The rats urinate on boxes of foodstuff, leaving dried urine on the tops of food cans. When a person opens the can without washing the top of the can or drink, diseases can enter the food in the can and then is ingested when the food is eaten. Also, the grocery store workers can become infected by handling boxes contaminated by the rat urine and feces. Continue with rats. Some rodent-borne diseases you see listed here. The rat bite fever, as I mentioned before, salmonellosis, plague, hantavirus. And not only do they spread those diseases, but the mites that may live on the rodents can also transmit typhus and rickettsia pox. And the fleas from rodents can also spread typhus, as well as the plague. To manage rodents, or rodent-borne disease management, if there's a rodent infestation, what you should do first, of course, is to contact a pest control professional. You can try the do-it-yourself methods like the traps or the glue boards, and these can be found at your hardware stores or any of your retail stores. If you should catch a rodent on the trap or the board, don't touch it. Place the entire trap or board inside of a plastic bag inside out. You reach in, grab it, fold it over, and dispose of it. Now, if you have pets that may happen to get caught on the glue board, you can use cooking oil spray to help release them from it. Once you've gotten rid of the infestation, the residence or the facility should be thoroughly clean. Now, it's recommended that you not sweep or vacuum rat droppings or urine or their nests. What you should do actually to clean it up: protect yourself by wearing rubber or plastic gloves. Spray the urine and droppings with a disinfectant or bleach solution and saturate the area and let it soak for about 5 minutes. Then use paper towel to wipe up the droppings or the urine and throw it in the trash. Then you can mop or sponge the area with a disinfectant or bleach solution. Wash your gloved hands, then remove the gloves and wash your hands again with soap and water, of course. For tick-borne diseases, the some that are mentioned here, you see Rocky Mountain spotted fever, typhus, again the rickettsia pox, relapsing fever, tularemia, and stari. Ticks are not insects, actually. They're more closely related to spiders. Of the ticks found in the South, the American dog tick and the brown dog tick are the most common. The brown dog tick rarely bites humans, but infestations are frequently found on dogs and in the home. The American dog tick attacks a variety of hosts, including humans, but they rarely infest homes. The American dog tick is frequently encountered by sportsmen and people who work outdoors. This is a tick that transmits Rocky Mountain spotted fever, tularemia, and other diseases from animals to people. It can also cause paralysis in dogs and children when it attaches at the base of the skull or along the spinal cord. Now, Lyme disease is actually transmitted by the deer tick, not by the American dog tick or the brown tick. Ticks attach themselves by making a small hole in the skin with the teeth that curve backwards. Then they insert barbed, piercing mouth parts to remove blood. Pulling the tick off can leave a running wound that can become infected. For tick bite prevention, avoid their habitat, reduce the population, wear long sleeves, long pants, and use insect repellent, and inspect and remove. Now, the ticks live in wooded areas and not out in the middle of the yard. Now, they can live in yards where the border wooded areas, ornamental planting, and gardens, or anywhere it's shaded and there are leaves with high humidity. By trimming shrubs and low branches, as well as raking and removing leaves, you can remove conditions that allow ticks to survive in your yard. Now, pay special attention to frequented border areas and wood piles and stone walls and sheds. Now, creating borders of wood, chips, stone, or any other landscaping material helps to serve as a visual reminder. Use insecticidal products to spray the perimeter of your yard. Also, treat pets with tick knockdown products. And pay special attention to children, your pets, yourself, and each other. When you see a tick, remove it immediately. Disease transmission usually does not occur until several hours of feeding, so the faster you get it off, the less likely are you to develop a disease. If a tick bite does occur and the disease is suspected, seek medical attention. Now, this next one is actually not a vector, but environmentalists get numerous calls about bed bugs yearly, and not daily, but yearly. Bed bugs, however, do possess the necessary mechanics to be capable of passing diseases from one host to another. However, as I said, they are not a known vector. A secondary bacterial infection can occur, though, from scratching, and rashes will develop in some individuals. Now, in a small percentage of individuals, an anaphylactic reaction may also occur. Over the last few years, we've been inundated with bed bug infestation calls, and this is primarily due to more international travel. Bed bugs are hitchhikers. They're usually found in dwellings such as houses, dormitories, hotels, and cruise ships, but have also been known to infest subways, movie theaters, nursing homes, hospitals, and planes. Also, bed bugs have just become resistant to the pesticides that we commonly use. But for bed bug control, if you suspect that you have a bed bug infestation, contact a pest control professional. Multiple treatments may be necessary. Them coming out one time will probably not take care of the problem. Some other methods that you can employ yourself, however, are vacuuming carpets and furniture and any visible bed bugs. Seal the bag, place them inside of another Ziploc bag, and then place it in the freezer because extreme temperatures will kill bed bugs. Wash beddings using soap and borax and then dry them at a high temperature. Pull beds away from walls and keep the covers off of the floor. They crawl up. Contents inside of drawers should be removed and cleaned and an insecticide sprayed in and under the drawer. Heat, steam, fumigating, encasement, and diatomaceous earth have also been found to be very effective in combating bed bugs. A few times a year, we also get questions about egg bum syndrome, which is actually delusional parasitosis. This is definitely not a parasite. It's not a vector. It's not even a vermin. It's all in the person's mind. But because we're talking about things that you may encounter, I decided to add this as well. It's actually a form of psychosis when the victim acquires a strong delusional belief that they are infested with parasites. Delusional parasitosis is sometimes difficult for doctors to diagnose, however, because an actual skin disorder or an allergen or dermatitis or a real parasite sometimes is actually there and can cause the itching sensation. Also, any skin sores or irritation that the person that's caused by the person scratching may look like a skin disorder, and so it may look like they are infected with something. And nearly any markings that they find on their skin, they definitely say this is proof that I have a problem and there are bugs just eating me up. The presentation evidence is also known as a matchbox sign because the evidence is frequently presented in a small container such as a matchbox. For pest control or pest management, pest control professionals should employ integrated pest management. Now, when they do that, the way they do that is through prevention, identification, and treatment. Prevention is the best management principle. Managing pests through prevention is usually less expensive than trying to control a pest problem that has been established. Once it has been established, it becomes important to eliminate it. Elimination is only successful if the condition that favored the pest are eliminated or entry has been completely blocked. Identification, you need to know what bug you're dealing with. Decisions on control methods should be based on past detection and monitoring results. The pest control professional has to know what organism they are treating. Monitoring also helps detect entry points. This can be done using any number of devices, pheromones, tracks, fly paper, sticky traps, etc. And then, of course, treatment. Use pesticides safely. Protect people and property. Use the correct pesticide for the pest problem. And they come in many forms. They're liquids or sprays, gases, dust, granules, and toxic bait. And then once you get rid of the problem, then there's exclusion. Build them out. And that concludes. Thank you.
Phyllis, thank you so much for that. We'll move on to Ron now.
Thank you, Ashley. I'm going to talk about food safety at retail food establishments, prevention of foodborne illness, and then do a little bit of an overview of an actual investigation in which a foodborne outbreak did occur, and just talk about what the environmental staff did as part of that investigation. So going into the food safety program itself in Alabama, each state develops its own retail food safety program. Alabama law authorizes the State Board of Health to adopt rules and regulations governing the sale of food at retail, and there has to be a sale of food for the regulations to apply. So anything that's given away would not be covered by a food permit. Now, a permit is required prior to opening a retail food establishment. And then permits are reissued annually for continued operation of retail food establishments. This is the legal basis for the allowance for the operation. In the event there's an issue with the establishment, the permits can be suspended or, if necessary, revoked. Our rules are based on federal recommendations, which are usually referred to as the food code, and every state uses some variation of the food code. It might be a different year. It's printed. Alabama uses the 2013 version. We use those standards unless there's something in state law that contradicts that or adds to it. For example, in Alabama, there's a state requirement related to labeling for of country of origin for catfish. That's not part of the federal requirement, but it's part of our inspections. The permits and the inspections are done by each county health department. And the rules for food establishment sanitation break the various violations into priorities, and I'll show you a photo of the inspection sheet shortly, but the priority items have 3 days to correct. The other items have 10 days to correct as long as they're a priority foundation. And then there are core sanitation items. Some examples of priority items would be things like temperature control for foods. 10 days to correct would be some plumbing issues. And core sanitation items would be something like general cleanliness or maintenance in an establishment. An emergency order of the health officer can be issued for some situations that would require an immediate closure. This would include a sewage backup into the establishment, complete lack of refrigeration, leaks onto the food preparation area, such as after a heavy rain and there's a problem with roof. If there's an overall score less than 60, that's an immediate closure, and a complete lack of hot water. And we have a term also that allows for an immediate closure that's called a gross insanitary condition. This is used for something like an extreme infestation with insects or with rodents, something like that. There's a list of the emergency orders that are kept on our website. Here's the address. Anytime you want to take a look at these, it's kept for the previous, I believe, 90 days. That shows all the closings that might have occurred due to the emergency orders, and it does some other inspections also. Phyllis had mentioned bed bugs, so if a hotel has to close a room for bed bugs, that's listed on this closing page also. And on to just general foodborne illness as it applies. CDC estimates are that 48 million people get sick every year from foodborne illness, with 128,000 being hospitalized and 3,000 dying from foodborne diseases. CDC has tracked foodborne outbreaks over several years, actually decades, and has looked at the contributing factors for the outbreaks, what went wrong during the food preparation part of it, and they've identified 5 factors that would apply in over 80% of the outbreaks. Those factors being an unapproved source for food, inadequate cooking temperatures, improper hot and cold holding temps, and unclean equipment or cross-contamination, or poor employee health or hygiene being hand-washing issues. And to go into a little bit of detail on these, an unapproved source, foods have to come from inspected production facilities or from sources that are exempt by law, like, for example, straight from the farm. But anything that's a canned product or processed product would have to come from a facility that's under some sort of inspection, and meat and poultry would have to come from some place that would be inspected by the Department of Agriculture. Inadequate cooking, the minimum cooking temperatures for various foods are set by the rules, and they vary from 145 up to 165 degrees, 165 being a poultry cooking temperature. For ground beef, undercooked ground beef being something that's often associated with Shiga toxin-producing E. coli outbreaks, the standard temperature is 155 degrees for 15 seconds. And then the other items were 145 degrees. Improper hot and cold holding temperature, hot holding items like on a hot bar buffet have to be at 135 degrees or above, or hold for no longer than 4 hours if you can't hold that temperature. Refrigerators have to be 41 degrees or below. And unclean equipment, cross-contamination. Unclean equipment is self-explanatory. That'd be something like a cutting board in which raw poultry is cut up, then not clean when a ready-to-eat food is used next, like lettuce on the dirty cutting board. Cross-contamination would be something from a raw to a ready-to-eat product, maybe in storage, like a raw hamburger meat, raw chicken stored above lettuce that would then be served without cooking. There's a possibility of bloody juice dripping into the lettuce, and that has been the cause of outbreaks. And poor employee health and hygiene. Hand washing stations have to be provided within the establishment and stocked with paper towels and soap. Ill employees have to report certain diagnoses to the manager, and this is a requirement of the food rules. These are spelled out, and some detail is given within the rules themselves about what the ill employee can do, or possibly even be completely restricted from any food work. But if they're diagnosed with norovirus, hepatitis A virus, Shigella, Shigadoxin-producing E. coli, Salmonella typhi or non-typhoidal salmonella, they have to report that to the manager, who will notify the health department and determine what can be done for that employee as far as working in the establishment and around food. And this is just a cropped version of the Alabama's inspection report. The red items there are priority or priority foundation. That's 3 days or 10 days correction, which was mentioned earlier. And the black items are the core sanitation issues. Each one of these has a weight, 4 or 5 points for the red items, 1 or 2 points for the black items. A perfect score is 100, as the environmentalist notes problems within the establishment is correlated to the sheet with a score on it. That's subtracted from 100, and it ends up with a score that you see posted on the wall in all the restaurants and grocery stores around the state. And preventive measures are often just given as the 4 bullet points. This is something that fightback.gov provides, and it's in a lot of public service announcements. It's easy to remember. Just clean, cook, chill, and separate. Clean, then keep the equipment clean, keep the hands clean. Cook, the proper cooking temperatures. Chill would be the refrigeration temperatures at 41 degrees. And separate raw and ready-to-eat foods. So what if something goes wrong and there is an outbreak? I wanted to walk through the environmental response to one that had occurred in 2015. And I will emphasize this is just one part of the overall outbreak. This was the environmentalist response. There was a lot of other activities going on associated with this particular one, with IDNO making a lot of contacts and calls and working up the stats that are associated with this, and the lab doing work also. This is the general process on how it normally would work. The situation is reported to the health department. Infectious diseases and outbreaks, IDNO is the lead on the investigation. The environmental office investigates the food preparation at the establishment wherever this occurred, and will collect food samples if there are some available. And then the lab runs the appropriate test. And the one I'm going to talk about here is Sunnyside child care outbreak. This was a Montgomery County Health Department environmental staff investigated this for the environmental side. It occurred in 2015. And I did want to point out that the slides provided here in this information is provided by the Montgomery County Health Department. Cindy Gucher, Melanie Bogan, and Wes Rogers were the leads on this and provided the photos here. Sunnyside Daycare had 2 locations. This is listed as point A and point B. Food was supposed to be prepared at one and would have been transported to the other. And one of the locations did have a permit from the health department. This gives their location addresses. Location A had the kitchen by the health department, but permitted by the health department, but normally did not have kids there. It was a cooking site. Location B did not have the permitted kitchen, but had the kids where the food was transported to it. They were also running a what's normally called a summer feeding program. There was no notification to the health department about this. The total on this, about 300 children attending the 2 daycare locations. On the day of the outbreak, the call came in about 3:30 p.m. A concerned parent called saying her child was attending the Sunnyside Daycare and was sick, and then also mentioned that several kids were throwing up in the hallways when she picked her child up. The environmentalist took this call and sent a message to the area investigator, which is following through the standard process of notification. The area investigator had made some other calls, and it turned out that there were 18 children in the hospital areas already. So at 4:30 p.m., the environmentalist left from the health department to go see if there were any samples available and complete a form that's the environmental assessment report, which goes over some of the CDC risk factors and a few other items associated with food prep. And this is just a kit that's taken with the environmentalists when they go out. It includes a thermometer and forms, gloves, and ice chest. Some of the questions that will be going over with, in this case, the owner of the establishment. We're trying to get a list of the foods that were served that day, including a copy of a menu if one is available, and then go through the process on how was the food prepared, how was it held, like refrigerators or whatever, and how was it served, and are there any leftovers available for sampling. I also want to know, were there any sick children that day, were there any sick employees? Going back to the sick employee issue with one of the CDC risk factors, there should be a sick employee policy on file on given the restrictions on what employees can do and how they report. We also try to get invoices and receipts for the food to correlate back to an approved source. Check the temperatures of the refrigerators and freezers, of course. Check the hot water temperatures at hand sinks and the utensil washing sink. Make sure there's soap and towels at hand washing sinks, and availability of bleach and test strips to test the strength of the bleach. Also check the storage of chemicals. It would be things like cleaners, and the food sources, including expiration dates. When they went to visit the daycare kitchen, they found the stove had been removed. They were building storage for a double oven there, and there's some crock pots on the back. With no stove, they were using crock pots to cook the food for the service to the kids. And using residential refrigerators. One of the issues with residential refrigerators is they're not designed to cool large quantities of food. They work fine at home, but that's for home amounts of food. When you're cooking for 300 meals, then it may be tough to do a proper cool down with that. There was some food left over that was in the trash can, but the food that's left over that day that they could retrieve are apple slices, bread, bologna, and noodles with chicken. And it was in the trash can. The samples were pulled out of the trash can and bagged and labeled for transport to the lab. And obviously the food was commingled once it was in the trash. We tried to separate it out as best as possible to take to the lab and identify it on the specimen bags. That was location A. We went to the second location at the other address to find out what was going on that day. This is the one with no food prep, supposed to be there. And when they got there, they did find that they had some food stored, refrigerators in place, and plenty of milk available. And we're using some commercial food prep items, a commercial microwave oven available, and some other equipment, including a slushy machine, toaster, and so forth. So obviously there's some food preparation going on. IDNO also requested samples of soiled diapers just to make sure that there would be a stool specimen available for testing if needed. So the environmentalists went back into the trash and pulled out the soiled diapers, bagged, and transported to the lab. The detect kit provided by IDNO was used for this, so all the items collected for samples were bagged and labeled. And then the day after the outbreak, they returned to ask some more questions. Keep in mind, this was at the end of the day, after 5 o'clock. So the next day, they returned to talk to the cook specifically about exactly how the food preparation was done. The cook said there was no thermometer available, and he didn't check temperatures anyway during any part of the process. And looking at the food items, one of the items, the chicken and pasta, got a timeline on that, and frozen chicken leg quarters were purchased on the 21st. These were thawed in the kitchen refrigerator. On the 22nd, the thawed chicken was cooked in the roasters and used some other ingredients for that, and it was served that day. It had some leftovers, so that was put back in the home-style refrigerator to cool overnight. And on the 23rd, which is the day of the outbreak, the leftover chicken was taken out of the refrigerator, torn off the bone, placed in one of the roasters to reheat, and cooked it with pasta, and was served for lunch. The environmental assessment report, or the EAR, was completed, and for both locations, And what this does is look at those items associated with CDC risk factors. There's an emergency order issued to close the establishment because it was the site of a foodborne outbreak. One of the conditions for reopening was for the staff to take training that was provided by both the environmental office and ID&O staff and complete that. The samples that were transported to the lab results came back. It was positive for Staphylococcus aureus in the chicken and noodle samples. Staph is a toxin that is formed in food held at improper temperature, and it is heat stable. Once it's reheated, the heating process will not denature the staph toxin. It's going to be there. And PFGE results from both the clinical and environmental samples had matching DNA profiles. And also mentioned that any time there's a foodborne outbreak, there will be a lot of media attention, and if children are involved, that will ramp up much higher. The department worked on news releases at each step of this process to keep the public informed of what we knew at the time we knew it. We knew it was an outbreak, then we knew what the cause was, then we knew the samples had been collected, and then the final report from the lab. So this was done to keep the public informed as best we could of what we knew at the time. And the aftermath of this is that we had a total of 86 children in the hospital with symptoms. 30 were hospitalized overnight. Staph aureus tested positive in environmental samples and matched clinical samples. The daycare was allowed to reopen on June 29th. They had corrected the temperature issues, that completed the training course, and all the other requirements set forth by the Montgomery County Health Department. This is not something the health department tracks, but this was news items. There were at least 4 separate lawsuits filed associated with this also. And that was the end of the foodborne outbreak investigation on that. Again, the environmental part of it, which I'm talking about, was just one slice of the pie. The lab and ID&O had a lot going on. As part of that was something that big. It involves a lot of people. But now I want to also mention a little bit about the overall ADPH food safety program, our retail food program, which involves those inspection reports that I mentioned earlier. What we call retail food includes all of these items here, all types of establishments, including daycare centers, schools, hospital kitchens. Also includes jail and prison kitchens. The same inspection report is used for every one of these facilities, and a score is obtained. And we also inspect other than retail. We do milk and milk products, bottlers, bottled water, peanut butter manufacturers, vegetable processors. There are about 360 various types of various establishments doing various types of food processing in Alabama. We do not check red meat and poultry processors. That's Department of Agriculture. And the last slide I have is just a reference to some general food safety information. It's easy to remember, foodsafety.gov. This gives some food safety tips. It has a list of recalls if you're interested in that. It's a good resource to go to just for any kind of food safety information. And that's my last slide.
Brian, thank you so much. Before we move on, we did want to ask you one quick question. What kind of action can parents take when it comes to a daycare like this? Do they have rights to demand to see an area where food is prepared, or is that just something that they might want to think about doing?
They might want to think about doing. The daycare will not be obligated to allow anybody into the kitchen, but you certainly come to the door and see if it looks clean and looks professionally maintained. And you can also check for a health department inspection and an inspection score associated with it.
Is it true that some daycares are exempt from health scores?
Not from health scores, but the Department of Health and the Department of Human Resources does have some exempted daycares from their regulations, but the daycares are not exempt from Health Department kitchen regulations.
All right, thank you.
Yeah.
We'll go ahead and move on to Latasha.
Well, today I want to talk with you about vaccine-preventable diseases and some outbreaks that we've had. I want to speak with you about mumps. It is a contagious disease caused by a virus. It is spread from person to person via direct contact or by droplets of saliva from the mouth, nose, or throat of an infected person when they cough, sneeze, or talk. It may also spread when the infected person touches items or surfaces without washing their hands, or touches contaminated surfaces and then their mouth or nose. Some signs and symptoms that I want to go over with mumps. They usually appear 2 to 3 weeks after exposure. It causes parotitis, which is swelling in the jaw, or even known as puffy cheeks. It causes fever, headache, muscle aches, tiredness, and loss of appetite. Possible complications could be orchitis, encephalitis, meningitis, oophoitis, and deafness. Preventions of mumps could be preventable by 2 doses of the mumps vaccines, and mumps vaccines can be given separately or as part of the MMR that also protects against measles and rubella. The specimens that we prefer when taken for mumps is the buccal swab. To diagnose mumps, a swab is taken from inside of the patient's cheek. Next, I want to talk with you about pertussis, also known as whooping cough. It's a highly contagious respiratory disease caused by bacteria, spread from person to person by coughing or sneezing. Infected person are most contagious up to 2 weeks after the cough begins. Some signs and symptoms are minimal or no fever, runny nose, sore throat, mild, dry cough, can continue for months, become severe within 1 to 2 weeks. And it resulting in a long series of coughs followed by a whooping noise as the person struggles to breathe and or vomiting. The cough is often worse at night. Prevention of the whooping cough, of pertussis or the whooping cough, is the vaccine. Preventative antibiotics are also used in those who have been exposed and are at high risk of pertussis. The specimen preferred is the nasopharyngeal aspirate for PCR testing. My next slide is on varicella, also known as chickenpox, a highly contagious viral disease caused by the varicella zoster virus. It's an airborne disease which spreads through the coughs and sneezes of an infected person. It may spread 1 to 2 days before the rash appears until all lesions have crusted over or through direct contact with blisters. A person with shingles can also spread chickenpox. The signs and symptoms of chickenpox are blister-like rash, itching, fever, headache, tiredness, and malaise. Some preventions of varicella are the varicella vaccine, vaccinating within 3 days, reducing the infection rate and severity. Preferred specimen would be the lesion or scab for PCR testing. Now I want to go over some of the outbreaks that we've been dealing with for 2017. My first slide that you're looking at, it goes over the total investigations for mumps, pertussis, and varicella for the year. For mumps, we had a total of 55 investigations, and of those investigations, 41 of those were considered cases, and 39 of those were a part of the outbreak that we dealt with. And then for pertussis, we had a total of 190 cases. 130 of those were true cases. Well, we had 190 investigations that we looked at, but 130 of those were true cases, and 33 of those were a part of an outbreak. And then for varicella, we investigated 365, and 4 of those were true cases, but we didn't have any of those that were part of an outbreak. For mumps, we had a mumps outbreak in Tuscaloosa County, and out of the 39 total ill, 39 of those, which was 100%, were up to date for their vaccination. 9,672 of those people were exposed, and all of this resulted at a university. And how we got in contact was through, we received a call from a doctor in the area who had actually did the testing for our initial first 3 cases, and he reported those 3 individuals to us. So we began the outbreak from that standpoint. And from those 3, we started to connect the students to see who they were in contact with per class, classmates, sleeping quarters, parties, or whatever, wherever they've been, we wanted their contacts. So we got email addresses from the school. We took the email addresses, we created a questionnaire. We would send out the questionnaire to all of the students that were in contact with the 3 individuals, and for every student that were tested, that came back ill, that went into the health center. After they would go into the health center and they would say that they came back positive, we would email. Out of those that were emailed, we ended up emailing 500, over 500 students. 500 responded. Of those 500, 500 responded. So 57 others reported ill out of that 33 that we know for sure that were positive. And we had other diagnoses that were similar to the symptoms of the flu that we linked to, and they became epi-linked to our cases. So we had the some that tested negative as well. They came back negative tested once we tested them, but some that didn't test at all, but they had similar symptoms. They had the parotitis as well as for 2 or 3 days. So we would epi-link those according to if they stood within the boundaries of the case definition. And this is our the layout of what resolved from what we got from the individuals that ended up being the case. We have the 1 probable that actually started the case, and then we have the 13 that were laboratory confirmed, and the other 25 that were epi-linked. They became epi-linked probable to the cases, and they were we did them by dates, according to the dates, and all of them have different colors based on that, how they were linked. Our next outbreak is the pertussis outbreak in Chambers County, and out of that we had 33 total ill, and 19 were up to date, which ended up being the 58%, and 14 were not up to date, which was 42%. We had 1,729 people exposed, 1,203 immunization histories were looked up in imprint, and 1,075, which was 89%, were up to date according to imprint, and 1,028 were not up to date according to what we pulled from imprint. And this is also our graph from that information according to what we got out of the 14 epi-link confirmed cases and the 19 laboratory confirmed cases. And this is also according to we did it by the dates that everybody came, if they were positive or EpiLink. And as requested by our Assistant State Health Officer, Dr. Karen Landers, all county health department nurses should be trained to obtain the 4 specimens for vaccine-preventable diseases, which are blood, buccal, nasal, pharyngeal, aspirate, and lesions. Once the specimen is obtained, it should be packaged according to standards and shipped to the BCL according to the specimen requirements. And we're asking that if anyone is not or does not know how to obtain the specimen, we do have a trainer that is qualified to go out and do the training so that we can get the specimens that we're needing to make sure that we get what is needed for our division. Thank you.
Thank you so much, Latasha. Our next presenter will be Miss Marilyn Knight, and she will give us a little bit more information.
Good afternoon. Thank you. On today, we just want to reinstate, our purpose on today is to reinstate the CDC infection prevention guidelines. This information is not new to our staff in the county health department, but we feel that it's very important that we reiterate these steps every year to keep us all refreshed and hopefully doing the things that are correct to prevent us from transmitting disease, either between staff members or from staff to client. All right, so today we want to cover hand hygiene, personal protective equipment, injection safety, environmental cleaning, medical equipment cleaning, and respiratory hygiene, cough etiquette. Now, according to the CDC, effective hand washing is the single most important defense against the spread of disease and infection. And we all understand hand hygiene, or we hope everybody understands hand hygiene. But in the flow of the clinic, sometimes things get very busy, and it seems like we're in a rush, and we oftentimes can kind of slack on our hand hygiene. We want to remind everybody hand hygiene is very, very important to reduce the spread of disease and infection. So the preferred method of hand hygiene is the use of alcohol-based hand rub, except when hands are visibly soiled. In a healthcare setting, it was determined that alcohol-based hand rub was a quicker method for cleaning hands, and so it is the preferred method when you're in a healthcare facility. But if hands are visibly soiled, they have dirt, blood, body fluids, or any other substance on them, soap and water is the more preferred method. When it comes to hand washing, and we recently had this topic to come up in a county health department, the use of hot water. Hot water is oftentimes preferred by healthcare providers, but the CDC in their Show Me the Science indicates that cold water is just as effective in decreasing the spread of disease and infection as hot water. In hand hygiene and hand washing, what's most important is the amount of time you use washing your hands, the amount of friction you use, covering back and front and in between. So you don't necessarily have to have hot water to wash hands. Cold water is effective and will kill the germ if you use proper soap and the proper technique and the proper time. And we've all probably heard it for years. If you sing the Happy Birthday song 2 times through, which takes you about 20 to 30 seconds, that is enough time to kill any germs or any bacteria that may be on the hand. So we want to reiterate and remind people, if you have water, hot, warm, or cold, as long as you wash your hands properly for the correct amount of time, it can kill disease. So when it comes to hand hygiene, remember, you always want to perform hand hygiene before and after any physical contact with the patient. After physical contact with blood, body fluids, items that contain blood, body fluids, or other secretions from the patient. If you are going to be doing any aseptic tasks, be sure to perform hand hygiene, and also after you remove your gloves. Personal protective equipment. In the county health department, your PPE is very important to keep you as the provider safe and also to keep your patients safe. So we want you to utilize all of your PPE effectively. All right, so it's utilized to protect the healthcare provider from coming in contact with infectious substances. Personal protective equipment should always be donned when there is the potential of exposure to blood, body fluids, or other infectious substances. Things to remember when you're using your PPE: remove and discard all PPE before leaving the patient care area. Once again, I know in the county health department you get busy, but a provider should never leave out of the room with a patient, go into the hallway or into other areas of the health department with the same set of gloves on that they were using while in the room with the patient. It's going to take you a little extra time, but anytime you have to leave outside the room, remove that set of gloves, perform hand hygiene, do what you need to do outside the room, come back in. If you need to redon gloves, do that, but you should never leave a room going outside the patient care area with a used pair of gloves. PPE should be changed between patients. Okay. Now I want to talk a little bit about injection safety. A few years back, if I'm not mistaken, around 2014, looking at the number of needle stick injuries we were having in county health departments, a decision was made to use retractable devices for all injections and for venipuncture or drawing blood in the county health department. Now we hope that all county health departments have went to all retractable devices. I know for vaccine administration, there are some doses that come pre-filled and you may not have a retractable device in that situation, but if you are drawing up your own meds, you're drawing blood, you should be using retractable devices in all county health department. Retractable devices have shown to reduce the risk and the occurrence of needle stick injury in the health department, and this decision was made in order to protect our employees. So we want to remind everybody you should be using retractable devices in your county health departments. Okay? Ambulatory care settings experience challenges, injection practices that can lead to patient or healthcare provider injury. To reduce this risk, specific measures such as the use of retractable injection and venipuncture supplies has been established in all county health departments. So always employ an aseptic technique when preparing and administering medications. Never, ever reuse a syringe, and always use retractable devices according to the manufacturer instructions. And going to various county health departments, I have had situations where nurses or aides that perform venipuncture were engaging the retractable device after they had withdrawn the needle from the patient's arm. But that's not according to manufacturer instructions. You actually engage the retractable device while it's still in the patient arm, and that reduces the risk of our patients suffering a needle stick. Always dispose of used injection venipuncture supplies in the approved sharps container that is closable, puncture resistant, and leak proof. Environmental cleaning. Cleaning and disinfection of surfaces in patient care areas should be conducted on a regular basis. Cleaning should involve the removal of all visible soil and contamination utilizing scrubbing action and surfactant or detergent and water. Disinfecting should involve the use of any approved microbial interactivation substance that eliminates recognized pathogenic microorganisms. Develop a regular schedule to clean and disinfect surfaces in patient care areas and items that are frequently touched. Use only EPA healthcare settings, approved disinfectant, and following all manufacturers' instructions for use of approved disinfectant. And if I'm not mistaken, it may have been on last year, during last year's program, we talked about some of the different medical equipment that we use and that maybe we don't often think about how often we clean those, like blood pressure cuffs. You know, it's been a very, very hot summer in Alabama, and some people sweat more than others. And so sometimes just thinking, how often should I clean my medical equipment, and coming up with a plan so you can keep that equipment clean and try to reduce any risk of cross-contamination or transmitting disease or infection to anybody. So a plan and procedure for the cleaning of reusable medical equipment should be established to prevent the transmission of infectious diseases. Critical items such as surgical instruments should be sterilized according to the manufacturer's instructions. And non-critical items such as blood pressure cuffs and other reusable points of care equipment should be cleaned regularly in accordance with the manufacturer's instructions. Respiratory hygiene and cough etiquette should be utilized with patients and any other visitor to the healthcare facility to prevent the transmission of respiratory infection. And once again, I just want to remind everybody out in the county health department, most county health departments have the respiratory station. I believe that was given to all county health departments during H1N1. It's the little stand where you have the mask, the hand sanitizer, and the facial tissue. Oftentimes when I go to county health department, I see those stations, but sometimes it may be out of facial tissue or it may be out of hand sanitizer. So we just want to remind the county health department it's very important to have a person who kind of regularly goes around, checks those stands to make sure they're supplied. So in the event that a visitor or a patient comes into the county health department and they need something from that respiratory hygiene stand, that they can be able to use that and hopefully decrease any possible spread of disease. So with respiratory hygiene and cough etiquette, remember to cover your cough. Cover your cough signage should be posted in the area visible to patients and visitors. Respiratory care items such as tissue and masks should be made available for individuals with signs and symptoms of respiratory illness. Immediately perform hand hygiene should hands come in contact with respiratory secretions. And if anybody is interested in reading through any of the guidelines, here is the link, the Guide to Infection Prevention for Outpatient Settings, the Minimum Expectations for Safe Care. It was last updated in 2015. These guidelines don't change very often because they do cover the standard precautions that are necessary for preventing disease transmission in the county health department. And we know the staff in the county health department are working hard to see the patients and provide care to the citizens of Alabama. We just want to remind you of these things, keep them in the back of your mind so as you're providing that care, you remain safe and your patients remain safe. Thank you.
I do have a quick question for you. You started talking about the reusable medical devices and things of that nature. You said to check the time that the manufacturer says for cleaning. What would you suggest? Could you expand a little bit upon that?
Well, and I think that may be a decision that is best made by the nurse supervisors or those in control at the county health department. Manufacturer may have a suggested schedule, but if you know that cuff is the main cuff and is used more often, then you may want to up that schedule and do it at a time or on a schedule that works with the clinic and also keeps the equipment clean. So I don't know that there's a set time for every piece of equipment. I think it would be based on use and how often it's used in the county health department.
Good deal. Thank you. And Phyllis, I had another question for you really quick. You were talking earlier about repellents that folks could use to keep away some of these insects. Could you just expand on the things that people should look for when selecting a different kind of repellent?
Well, EPA has actually recommended that they find a repellent that contains the ingredients that I mentioned before, DEET, picaridin, IR3535, or oil of lemon eucalyptus. Now, oil of lemon eucalyptus is not suggested for small children. And, of course, even with DEET, I've encountered some people that said they were allergic. So my suggestion actually is to visit the EPA website, and there's a host of insect repellents that are there, and try to find something that works for you.
Are there multiple repellents for different insects? Like, are there some that would be good for some insects and then different
On
for others?
the EPA website, I do believe it is divided up to some extent in what insects it will repel, but for the most part, if you get the DEET or the picaridin or the R3535, it should just be an insect repellent.
Perfect. Thank you all so much for coming today, and thank you so much for viewing today's program. You'll be able to watch this program on the on-demand section of our website. You can go to publichealth.gov/ALPHTN. Thank you so much.